In this 10-minute talk, you'll learn all that you need to know about the imaging of patients who have experienced blast injury and ballistic injury. So blast injuries are classified into three main categories, and we're going to go through these in turn. Let's start with the primary blast wave, which is a very high pressure wave affecting air-filled structures like the sinuses, middle ear and lungs, and fluid-filled structures like the globe and gravid uterus. So we know that at the center of the blast, there is extremely high pressure due to the blast. But as we move away from the center of the blast in open air, 5, 6, 7 meters away, the pressure significantly decreases. However, if the patient is in an enclosed environment like a tunnel or a basement, this doesn't happen. The blast wave instead will ricochet around the tunnel or the enclosed space. It will reverberate and amplify. And so therefore, people involved in a blast in an enclosed space are more likely to have severe injury. Let's look at the type of primary blast injuries we might see and start with the globe. So the globe, because it's a fluid-filled structure, will absorb the high energy blast wave. It completely ruptures and collapses down, and there's vitreous hemorrhage within the globe itself. Similarly, air-filled structures such as the maxillary sinus will expand and cause surrounding fractures and then fill with blood. And if these communicate with the base of skull, this will be accompanied by pneumocephalus. Further, air within the middle ear will be affected by this high pressure blast wave, and you may end up with blood within the middle ear, as well as displacement of the ossicles. In this patient who has a frontal and ethmoidal sinus fracture, this is communicated with the internal contents of the skull, resulting in pneumocephalus and subarachnoid blood. Patients may also have hemorrhagic contusions to brain tissue, either due to primary blast wave or other effects. If you suspect that the patient has a maxillary sinus fracture, you do not necessarily have to CT the patient, and it is important to limit the number of patients that you are CTing. Here we can see the fracture very clearly, and we can see the fluid level within the maxillary sinus. The only reason to CT this type of patient would be if you suspect that there has been an associated herniation of the inferior rectus muscles, as we see here. Moving on to lungs now. The very typical blast lung appearance is this butterfly-shaped perihilar haziness. And if you see this in a patient, it means that they are likely to have been close to the center of the blast, and it's a marker of severe injury, both within the lung and within the rest of the body. You can also see a variety of blast lung patterns, including patchy contusion, more extensive contusion within both lungs, as we see here, and finally, very extensive airspace shadowing. And patients can move very quickly from a normal chest X-ray to a very abnormal chest X-ray due to the nature of the blast lung injury. And so it's important clinically to triage and re-triage patients so that we don't miss their clinical deterioration. Blast lung can also cause pneumothorax, as we see in this patient. This patient had a normal chest X-ray, but they do have perihilar ground glass on CT, and we can see that there is a small pneumothorax, which could of course develop into tension. This is another reason to triage and re-triage patients. If we CT patients with more severe blast injury, you can see very extensive consolidation within the lung. This is a mixture of blood and fluid, and you can see the branching air bronchogram within it. Again, this patient has severe blast lung. And finally, there could be secondary effects, for example, due to rib fractures causing localized lung contusion. Let's think now about secondary effects. So this is due to flying fragments either within the bomb or surrounding the bomb in any way, shape or form. So the bomb may be packed with metal content, or there may be metal surrounding it. And a good way to identify all the metal fragments is either to do a whole body CT or to do a CT scout and make sure that you look at the peripheries of the CT scout so you don't miss any metal fragments. If you suspect that there is metalwork within the abdominal cavity, then CT will probably show you free air and blood within the peritoneal cavity. You can also identify the metal fragments, but do not spend too long trying to work out the trajectory of these metal fragments, because in this situation, the metal fragments will often ricochet around the peritoneal cavity and cause injury to multiple loops of bowel. And so this patient is going to have a laparotomy. Your job is actually to identify the other injuries that the surgeons may not see so readily. And the same is true for bullets. Again, they will have a ricochet pattern around the abdominal cavity. Flying fragments can also fly into soft tissues, and there can be multiple fragments associated with soft tissues which are difficult to work out. So there may be metal, there may be glass, there may be bone, and the bone may come either from the patient themselves, or it may come from someone who was standing next to the patient. And in general, there may be any types of debris whatsoever within the soft tissues of the patient. The tertiary blast effect is when the body is picked up and thrown against a wall or against a surrounding structure. And this is called the blast wind, and it is of the energy of a hurricane, very high energy indeed. When the patient is picked up like this, you may see, for example, splenic lacerations. You may see fractures of the spine or of the peripheries. Traumatic amputation is due to a combination of the primary blast force, which passes through the bone and causes multiple fractures, as we see here, and then the blast wind, which picks up the fractured soft tissues and detaches them from the underlying limb. This is the mechanism for traumatic amputation. We need to take special consideration for women who are pregnant and for children. Women who are pregnant, the amniotic fluid will amplify the blast wave and be more likely to cause injury to the fetus. Further, the gravid uterus can cause injury to the remaining solid organs in the abdomen. Children also are more likely to have more severe injuries, and so they should be prioritized for higher level care. It is important to try and keep children together with their carer or parent, if at all possible. Finally, let's think about gunshot wounds. So there are multiple different firearms which have multiple different energies, and these have different effects on different tissues. But the important thing to remember is that when a bullet passes through a tissue, it causes a permanent cavity and a surrounding temporary cavity. And for both of these, the bullet has delivered energy. And the degree of energy that is delivered corresponds to the width of the cavity and the length of the trajectory. So a higher energy bullet will cause a bigger cavity and a longer trajectory. So let's look at these two patients and work out which patient has a high energy wound. You'll see that both the patients have pneumothoraces anteriorly, and then you can see in patient A the permanent cavity here, which is wide and thick, whereas in patient B, the permanent cavity is rather narrow. Therefore, patient A has a wider permanent cavity and more energy delivered to them. So patient A has the higher energy gunshot wound. You can also search for the bullet in the patient, and in the patient B on the right, the bullet has embedded in the chest wall. This is because it's lower energy, whereas in patient A, the bullet has passed out of the patient because it's higher energy and it has a longer trajectory. I'd like to thank you for your attention. If you have any questions or you seek any help, please use our emails to make contact with us.